Hi there, my name is Virani. I'm the head of cardiology here at Providence Healthcare and the physician program director for the Heart Center at St. Paul's Hospital. It's my pleasure today to welcome you to Providence Heart on Davie Street. This is the home of our chest pain clinic and our stat clinic. Both of these innovative programs were conceived of 18 months ago. It was at that time that we began to realize that there was opportunities to improve the care for our patients with chest pain and other cardiovascular problems who present to the emergency room. Like all innovative programs here at St. Paul's Hospital, we work in collaboration with our partners. In this case, it was with the Department of Radiology and the emergency room to come up with interesting and transformative ways of working with patients and their families to really foster and develop a patient-centered model of care. What does that look like? That looks like wrapping care around our patients, making it easy and seamless for them to get care when care is needed, whether that be for chest pain or any other cardiovascular problem. Come with me. I want to show you around and introduce you to a few of my colleagues. The origins of the chest pain clinic, again, started about 18 months ago. And it was at that point that we began to look around and see what were the best centers in the world doing. What was the standard of care for patients presenting to the emergency room with chest pain? That took us to Scotland, and that took us to a group there who was using innovative technologies to help identify coronary artery disease or blockages in the arteries of the heart early on in a patient's disease course, helping to understand whether patients needed treatment urgently or whether that could be done in a more of an ambulatory setting. And part of that is also the acquisition of new equipment, like a high-tech CT scanner. And that's where partnerships with radiology and the foundation, who actually make it happen, came to be. The most impactful thing the chest pain clinic and the stat clinic can do is provide patients and families with reassurance. Patients and families want to be reassured that there's a plan in place for whatever symptoms they have or for whatever disease we ultimately end up uncovering. The chest pain clinic ensures that diagnosis occurs promptly, that there's a plan in place, and a team of individuals that can take care of their questions and their needs, whatever may emerge. The innovative chest pain clinic and stat clinic are now models of care for other jurisdictions within the province. We've been able to spread our reach and meet and see patients that are in other parts of the province where they may not have access to regular cardiology care. Reaching out to emergency rooms, small communities, now with the help of telehealth and virtual health, really allows what we've done here at St. Paul's Hospital to be transformative across the province. We really look forward to expanding the reach, impacting more patients, and really turning the corner on cardiovascular disease in this province.
Hi, my name is Chou. I'm the physician lead for general cardiology at St. Paul's Hospital, as well as the physician lead for the chest pain clinic. Since the start of the chest pain clinic last November, we have seen over 300 patients. What we do is we streamline patients that are lower risk with chest pain to the chest pain clinic, where they will get outpatient rapid access to a cardiologist, instead of them having to wait in the ER to be seen by the on-call cardiologist. In doing so, we decongest the volume in the ER, we allow the on-call cardiology team to focus on the sicker patients, and we also shorten the patient's time and exposure in the ER. At every clinic visit, we talk to the patients and start treatment if they have heart disease, or we reassure them if they don't have heart disease. One of the innovative ways the chest pain clinic has impacted patient care is the development of an evidence-based algorithm where emergency physicians and even cardiologists can use this algorithm to decide on the most appropriate cardiac test for each chest pain scenario. And currently we are integrating this into our hospital electronic medical record system, but it's also available online. The referral process is very simple. We are currently only accepting referrals at this moment from the emergency department, from the urgent care centers, as well as various clinics in the hospital. What happens for a referral is that the emergency physician will use the decision algorithm to decide on the most appropriate test for that patient. And they can actually book the test even before the patient leaves the emergency room. So that way they have an appointment time in hand and they're less likely to be lost to follow up. And the chest pain clinic will then book the patient to be seen by a cardiologist on the same day as their test. I'm extremely thankful for our colleagues in the radiology department, the emergency department, the stress lab, the echo department, and the nuclear medicine department in helping us enhance patient access and care. Through teamwork, they have allowed us to dedicate reserved spots for cardiac tests for these patients so that they can be seen rapidly before they're seen in the chest pain clinic. Otherwise, they would have to endure months and weeks of waiting as an outpatient. I do recall that on Christmas Eve, I was working in the chest pain clinic, and a lady had gone to the emergency department with chest pain that didn't sound cardiac, but because of the algorithm, she had a cardiac CT, and surprisingly, that identified a 70 to 99% blockage in one of her major heart vessels. And so I saw her in the chest pain clinic right after that test, and I was able to start treatment right away. And I'd like to think that she had a much better Christmas as a result of this. The donor funds have been instrumental in helping us provide a clinic space so we can do our ECGs, our Holters, our stress tests for patients, as well as provide a very comfortable environment where we can see our chest pain clinic patients.
Hi, I'm Dr. Kaila. I'm one of the cardiologists at St. Paul's, but I also have the privilege of working in quite a few different areas. Quite a few years ago, we were able to develop the STAT Cardiology Clinic, which provides rapid access to patients that are in the emergency room and also family physicians in the community that want rapid appointments for patients. There's a big gap between waiting for an appointment with a specialist being referred from their family physician, and the other option was going to the emergency department. When they come for their appointment, they are able to do it in this setting, which is much quieter than an emergency room. We can have a better and more detailed conversation and finalize the plan because we have the testing that was needed for them already completed. And what can I say about the space? It's an excellent space to have appointments with patients. It's close to the hospital. But it's been separate, which is a nice finding, especially in the time of the pandemic. So we've been able to see quite a few benefits from the institution of the STAT clinic. The emergency doctor's feedback to us is they feel much safer being able to discharge patients with a follow-up plan that they know that the patient's file and the patient's going to be seen by a cardiologist. And so when we saw the evolving pandemic, we were able to quickly switch to virtual care. And that has given us the opportunity to see patients locally and patients that we would not have seen previously. And so we've been able to provide specialty care to patients that previously would have to travel quite significantly for urgent consultations.
Hi, Jonathon Leipsic here. I practice medicine at St. Paul's. My area of interest is cardiac imaging. I'm formerly the head of the department here at St. Paul's, but I've taken on a regional role for Coastal Health, Providence Healthcare. My passion is serving the patients of Providence Healthcare, particularly as it relates to their cardiovascular needs, focusing on understanding risks of heart attacks, using imaging to advance our understanding of that risk, and also using imaging to help plan minimally invasive procedures. So as you can probably see, we're standing in here in front of our dedicated cardiac CT scanner, so-called cardiograph. This has been a purpose-built scanner designed right from the ground up to serve patients with heart conditions and to better understand their nature of their symptoms. This is a source of tremendous pride for me, and I feel very grateful to the foundation and to the donors who've afforded us this opportunity to be the first to use such a scanner in Canada and one of the first in the world. It's disrupted our practice, it's shortened our wait lists, it's improved our diagnostic accuracy, and I think ultimately it's provided greater certainty and comfort to the patients that we serve here every day at St. Paul's Hospital. So this CT scanner, you may sort of wonder as a layperson or even as a physician, how does a CT scanner help improve outcomes for patients with heart disease? Well, even though I love cardiac CT, I always admit that the radiation itself doesn't cure heart disease. What really cures it is working in concert with our clinical cardiology colleagues, with our emergency medicine colleagues, with the nurses and nurse practitioners, and with the patients and the dietitians and all of the ancillary supports that use the information that we get from the cardiac CT to personalize a patient's individual care. So instead of treating a patient based on their risk of having disease, we can actually take a look in a patient with symptoms and we can understand, do they or do they not have coronary artery disease? How extensive is it? How severe is it? And it's with that information that the cardiologist is empowered to make personalized treatment decisions for the individual patient in a fashion that reduces heart attacks over traditional assessment. If you're having symptoms that are more vague or atypical, it really offers us a chance to see patients in a more comfortable environment and really make thoughtful decisions around their care, also decanting and eliminating some of the real pressure that our emergency colleagues are facing with all the complex things they're dealing with, particularly obviously during this COVID pandemic. But one of the things that I realized was that it's kind of like in the old movie Field of Dreams, if you build it, they will come. And we built this program and suddenly we were getting referrals from everywhere. And while this was very exciting for us, what we realized in time was that we were not providing timely care to our patients. Our wait list went from 4 weeks to 6 weeks to 6 months to 8 months. And patients waiting with symptoms of possible coronary artery disease can't wait 8 months. And so through the support of the foundation and the generous donors, we've been able to introduce this dedicated cardiac CT, which is not only operating at a faster speed and providing excellent image quality, by essentially operationally driving efficiency. By only doing cardiac scans, we've been able to realize a significant improvement in our throughput. So we went from doing 14 cardiac CTs a day to doing 24 coronary CT angiograms a day without really a significant increase in our technologist capacity nor in our nursing capacity, really just solely driven by the efficiencies of having a dedicated cardiac CT. As a result, we've reduced our wait list back down into the few week time period, which is perfectly safe and reasonable for the indications that we're talking about.
As you can imagine, we're really excited about the new St. Paul's. This is a once-in-a-lifetime opportunity to impact healthcare for British Columbians, and specifically their cardiovascular care. In collaboration with our partners at the Foundation and our colleagues within St. Paul's and Providence Healthcare, we're exploring innovative and transformative opportunities for how we can actually deliver care in a new way. From management to diagnostics, intervention to, most importantly, prevention of cardiovascular disease. We're searching the globe to find those best practices and not being shackled by the current to vision the future. We envision the chest pain clinic will be different in the new St. Paul's. Looking at a new model of how we deliver care, redesigning our healthcare system. With a focus on virtual health and other forms of healthcare technology, we can expand and reach patients all across the province. With a focus on Aboriginal health, as well as really looking at our priority populations, including those who may be marginalized from a social perspective. Chest pain clinic and the stat clinic will be available to all of them through this new model of healthcare delivery. All of this is being made possible through philanthropy and generous donors such as yourself. With support from the Foundation, the hospital, all my colleagues working together, and placing a lens and focus on the patient and the family, we've been able to advance cardiovascular care for our patients. I know that many of you are interested in just that vision and mission. Many of you are interested in advancing research and education, and we've been able to do that. These dollars and this philanthropy has supported improved cardiovascular care through diagnostics, through management intervention, and once again, to support prevention of cardiovascular disease in this province. With New St. Paul's on the horizon and so many innovative programs that we want to be involved with, your ongoing support is going to make that happen. And we look to you, your generosity, and your visions and ideas for the future to build upon that, to drive us to that desired future state. Thank you for joining me on this tour today of the Chest Pain Clinic and the Stat Clinic. I hope you enjoyed it as much as I enjoyed taking you on the tour. Reach out if you have any more questions. I'd be very happy to answer them, as I know any of my colleagues would as well.
Thank you so much for what you do for us, our patients, and for the hospital.
Without you, I wouldn't be sitting here in this wonderful space telling you of our stories of success and our wishes for the future. So thank you.
That on behalf of all of my colleagues here in the Department of Medical Imaging, that I want to express my most sincere gratitude and appreciation.